So, why don't you each take a few minutes just to explain what's on your mind, what you are up to, what you do for the past couple of years, what projects you have going on. Get us up to speed on who you are and what's on your mind and what you do these days. Dr. Kahn, you want to start?
Sure, I'm much older and not nearly as good looking. Dr. Batiste and I are friends, and we were just chatting a moment ago before this went on. And the audience may not know, but he has this new book, and he got his first copy today. I guess the public's going to have to wait a few weeks, as I am, to get a copy, but you are going to want to read it. I read a preview of it. I think I wrote a little endorsement of it, and proud to do that because Dr. Batiste is a wonderful guy. I also told Dr. Batiste that I just ordered and got today a book by a preventive cardiologist with the title, Let's Treat Heart Disease Like Cancer. And that's something that I say to patients almost every day in the practice, that, we have this system to screen for breast cancer, colon cancer, prostate cancer, cervical cancer, occasionally lung cancer. But we do not screen people for heart disease. And it has been a soapbox of mine for 25 years. That's that book, Dead Execs Don't Get Bonuses, was just one piece of that. And we've got such good primary care doctors coast to coast, and the rest. But, we do a blood pressure, we do some blood work. We might do an EKG, although EKGs are not really a paid for benefit for a routine physical exam. And we send people on their way, but there's much more cancer screening. And it's a terrible deficit that has to stop. And for now, without doubt, the best test for screening is a low-cost CT scan called a coronary artery calcium CT scan. It does have some drawbacks, but boy, it is better than not doing anything. And I encourage the audience to read about, if you've not had a coronary artery calcium scan, maybe a $100 test, maybe a 1-minute test, same radiation exposure as a mammogram. And there are advances in cardiology beyond that, because that test actually is 1990, so it's over 30 years old, although it has gotten better and better. But for the value, for the availability, you just need a prescription from your primary care doc. The other thing that hasn't really changed in my practice, but the same kind of concept, let's treat heart disease like cancer. I literally tell this to my patients every day. If a person has the unfortunate circumstance, get diagnosed with prostate cancer, breast cancer, colon cancer, they get staged. They get a very careful evaluation. We know if the prostate cancer is 1.2 centimeters by 0.9 centimeters, and with CT, MRI, PET scans, we know if it's spread or not spread. We're much more casual about heart disease. We do a stress test where you don't even see the heart arteries. And a lot of what we do in cardiology is visual estimate. And much of that is changing now, I think, for the better, to artificial intelligence interpretation of stress tests, of echocardiograms, of electrocardiograms, and particularly of advanced CT scans. So I have embraced, since I used to be a cath lab doctor, Dr. Batiste still is, I used to rely on an invasive procedure to see heart arteries, a perfectly wonderful one. But now I rely on these artificial intelligence CT angiograms that actually involve just putting an IV in. So they're really not fair to call it an invasive procedure. Still a little pricey, sometimes insurance covered. But we have gotten to an era that can really be called precision cardiology, where we can, just like a cancer patient, measure things in cubic millimeters and know the specifics, something called plaque characterization. So I'm actually more excited. I enjoy my patient interactions more than ever because of this, the screening concept, identifying early disease, always better to prevent it. But there's so much early disease out there that is unknown. And no two cardiologists, Dr. Batiste and I, could ever handle all the people out there, even people just listening tonight, that have unknown, undiagnosed heart disease, and they're 1 or 2 tests away from knowing all the details. And now we have this precision, and we have food as medicine, and we have when appropriate, supplements. So we have stress management and community as medicine. And that's the topic of Dr. Batiste's new book on more community and relations and stress. But anyways, I'm pumped up. We can do a lot of good.
Thank you.
Absolutely. Well, first I have to pay homage to my friend Dr. Kahn. One of the things I think, first of all, that he minimized in the humble way, really the impact. I'd say that of his practice, as I listen to it, the most powerful tool that Dr. Kahn provides his patients is his presence, right? So I'll tell you that any physician, any cardiologist that you go to, the most important thing that they can give and deliver to you is a listening ear, to listen to your symptoms, to identify what your history is, to understand in terms of what your life is like, what you're going through, because the test is going to augment what he hears. And he spends the time. We just spoke about the time he spends with each and every patient going through and now using the tools we have available. So I think that that's powerful. That's what I'm trying to do in my world. So I have the good fortune of having a wonderful practice pattern where I do a portion of clinical work still, because that's important for me to understand what patients are going through, their challenges, right? It's easy for me to tell them what to do, but it's more important for me to listen to some of the barriers and helping them navigate and work through that. I also work on a large system basis of trying to influence the direction of cardiovascular care within my health institution care delivery model, in influencing the role of lifestyle and the role of plant-based nutrition inside of that. I also have the good fortune too, as well, of really overseeing a very targeted approach inside of our cardiac rehab program that spans 13 medical centers, averages about 7,000 patients every single year, and trying to figure out how we can tweak, how we can shore up the delivery of care of every patient every time. I'll tell you that there's hope. And so one of the things that we understand that the coronary tree, I'll give my description, then we'll jump into it, Steve, is that I see the coronary artery disease much like the forest. We walk up and we say, how's the forest look? It's beautiful. Look at these redwoods. They're all there. And we see it. We're looking at the trees, the leaves, and we're getting all excited over nature and doing our forest bathing. But we forget about beneath the surface, the roots that dig down deep. And so our coronary tree and vasculature is so complex, and we're learning more and more about it. I get so excited. I still get excited about cardiology as I do about plant-based nutrition, about uncovering all the things that I wasn't taught about inside of training. As we learn about women and heart disease, as we learn about the role of the endothelium, as we learn about the fact that, yeah, you can still have heart attacks, the role of stress leading to heart attacks, the role of all of these different factors, the role really of inflammation that we may describe as cholesterol, but just a confluence of things, and how we have to really use our lifestyle as well as a mixture of our providers to achieve the best life possible. So I'm excited. I'm excited to be here. I think there's plenty of opportunity for hopefully those listening to kind of learn from Dr. Kahn. I know I've learned from him, read his books too as well in the past. And so I'm looking forward to this conversation.
Thank you. So if we had a safe, I would say, what is the exact code to open the safe? And I would want to know with the most specificity, what is the code? So if I'm trying to prevent heart disease, strokes, erectile dysfunction, everything that happens bad from cardiovascular disease, what is, at the end of the day, the most specific formula, code, directions that you could give us? I know this should be the last question, but let's start out first. So what is the actual code? If someone said, I read your books, I'm completely motivated, I'll take the time, the effort, the money, I'll do whatever it takes. What is the prescription on how to avoid cardiovascular disease from all of your knowledge? Both of you could answer that.
Go for it, Doc.
All right, I'll jump in and we go from there. So just like those old master locks when we were in PE class, have to put them on, you turn it one direction, back the other, and back again. Three combinations. I'm gonna give you three things. How you choose to move your body, feed your body, and rest your body are the keys to it. So what you choose to feed your body is going to start and stop. First thing, in terms of my perspective, is your dark green leafy vegetables and cruciferous vegetables become extremely important because of the fact of the inorganic nitrates, the dietary nitrates that are there, and the power, as along with the fiber content. That's extremely powerful. some small role. I love next to this too as well. My berries for rich in antioxidants that are giving you that there. The beets, that's a mixture between the berries and the dark green leafy vegetables. I'm going to throw in there too as well the allium family. For those of you less familiar with that terminology, that's my onions and my garlic because of their antiplatelet effects and their decrease in inflammation. Those are going to be extremely powerful that I'm adding to that mixture that's there. And I love the idea of adding in my fermented foods because of giving me a little bit of vitamin K2, which in some small studies may be able to decrease some of that atherosclerotic burden and the coronary calcification that Dr. Kahn was alluding to. Movement, I won't go into great depths on that, just moving more than you sit in terms of it, being active and engaging and resting the body, right? And being aware of that sleep is so extremely important. The time that we sleep, avoidance of sleep apnea, if you can protect yourself against that too as well. That's a combination, I believe.
Thank you.
And I'll take another approach just to give the audience a different answer, because that was a beautiful answer and don't want to be duplicative. I would go a little more technical answer. I would turn the safe wheel to all the way to the right, and I would say get advanced blood labs. Okay, because I believe eating and exercising and resting the body and managing stress, managing your lifestyle is some very large portion of the pie for health. But as I've delved into more and more advanced testing, genetics are a big factor. And you can look good outside and have a pretty good lifestyle. And I see people all the time that have unexplained atherosclerosis, and it blows them away. So turn the dial to the right. Know your C-reactive protein, know your hemoglobin A1C, know my favorite cholesterol particle, your lipoprotein little a, know your standard numbers your primary care doc is going to give you, know your vitamin levels, vitamin D, but I sure urge you to learn how to get a omega-3 blood level. It's the number one nutritional deficiency in my practice by far. Vegans, meat eaters, very few people hit the target, and for brain health, cardiovascular health. So get advanced labs. I'm going to go the other way. About 40, 50 years ago, a prominent vascular specialist in Europe, Ernest Schneider, said, if you want to predict the presence of atherosclerosis, look at arteries. And he was talking about doing a carotid ultrasound. People go to Lifeline screening. Quality isn't great, but some people pick up atherosclerosis. Other people can find slightly more advanced and sometimes appropriately insurance covered and include that heart calcium CT imaging. And there is, even more advanced. And more, I'm turning it down one more time. And it's possible now at very low cost. This is one of the most amazing advances in the last 20 years to do some cardiovascular genetic screening. There actually are panels now to screen for your risk and potential response to high blood pressure therapy. There are slightly different panels. It's a cheek swab to screen for your risk and presence of what's called polygenic cholesterol disorders. Why am I plant-based and my cholesterol is still 240? You can test for that. And I also like to see, again, I know this is a little bit still elite and maybe not ready for everybody prime time, but we're not talking about spending thousands of dollars. We're talking about spending, $199. We're getting down to costs that are really amazing. You might want to know some factors like a gene called ApoE, what mom and dad gave you, and a few others. So I turn the dial in the technical world and add it to the lifestyle that Dr. Batiste just described. And then you can really, really, identify the course and the prognosis that a patient faces.
Thank you. Dr. Batiste, in the book Selfish, you mentioned the importance of gratitude in heart health. Can you elaborate on how gratitude impacts cardiovascular wellness?
Yeah, I think simply, probably the easiest common thread is going to be through stress. And one of the ways in which we identify that is that there is some degree of stress relieving when your perspective on life begins to shift from the problems to the solutions and what you're thankful for as opposed to what irritates you is probably the common thread. And that's the reason why you see a greater percentage of individuals who have a lower blood pressure, a greater percentage who live longer, who have a better control of their diabetes and so forth. And when we look at stress, you say, well, okay, well, how does stress do it? We understand stress has multiple mechanisms. Specifically, and this is something I go into depth about, is its impact on the endothelium. So multiple factors have told us, and a lot of literature, especially at Journal of American College of Cardiology, has identified the sequence that happens in with the amygdala, where we house all the memories of the triggers for stressors and fears and anxiety and things of that nature. And this turning the key to the stress hormone cascade that releases this neurohormonal release and this inflammation out the bones and into the lining of the vessels to destabilize them, can lead to plaque rupture, platelet aggregation or stickiness that's there, and lead to really dysfunction of this endothelium. The endothelium is that singular layer of cells that when it no longer is responsive, the vessel no longer can dilate like it should. It no longer can protect from invasion and infiltration of atherosclerotic process leading to inflammation. And so at that point, reactivity shifts and disease happens. There's multiple studies that have told us that this highway, so to speak, of the endothelium is a precursor for many disease states, whether or not it's diabetes, hypertension, cardiovascular events. And so that's what I believe the importance of gratitude and the mechanism and pathway likely is happening.
Thank you. Do we need to be 100% plant-based? And if not, which animal products are best to eat?
I'll jump in. I mean, I have been completely plant-based for decades and decades and decades. So I'm speaking to the public. I'm not changing my format. I have no desire to change my diet. But I have such respect for particularly a researcher in Los Angeles and Milan, Dr. Walter Longo, the number one most funded nutrition researcher in the United States, author of so many breakthrough research papers in prominent journals. And his ideal program, as he outlines in a book called The Longevity Diet, a wonderful book, is a whole food plant-based diet. There's no red meat, there's no white meat, there's no dairy in it. There are 3 servings of fish a week and 18 servings a week because he is a fan of eating 3 meals a day, small meals, but 3 meals a day. So there's 18 meals a week that are whole food plant-based of largely vegetables and legumes and modest amounts of grains, whole grains, and some servings of fruit. So, when patients talk to me, they're not all ready, and they'll leave the practice if you demand that they do exactly what you do immediately. So I very much encourage them to read that book. It's such a masterpiece. And if that's where they start, that's fine. Now, we all know there are downsides to fish. In fact, this week in the news was a scientific report that fish very commonly, I think it was from New Hampshire, fish sampled in New Hampshire had a lot of PFAS and PFAS, these so-called forever chemicals. It's horrible news. People should have the ability to get access to food that doesn't contain potentially, serious toxins. And it's been that case with fish for a long time, of course, with mercury and DDT and PCBs. But nonetheless, either choose a completely plant-based diet or what would be fairly called a pescatarian diet. And you're certainly way over in the health arena.
Yeah, I would agree with that. I think probably just in addition to the study you just mentioned, I think probably what's given me pause here literally over the past several weeks in terms of trying to tease folks towards the healthiest diet possible is the study out of New England Journal that spoke about the microplastics and the impact for carotid vascular disease that's there. And it's a growing concern if we look at environmental state and the level of pollution that exists, and really we're having our fish are feeding from there. There probably is no safe, even wild caught fish. So when we look at the confluence of things, what I've told patients is I can't, even though there's a lot of historical epidemiologic studies that like the Adventist Health and many others that pretend the benefits of pescatarian, I can't necessarily fully say that, but it is better than the red meat. There's no doubt. It's going to be better than the red meat and even the white meat, so to speak, as it relates to that.
Okay. What is your position on 1, statin drugs, 2, alternatives to statin drugs like red yeast rice or something else, and 3, just what else do you want to say about nutritional supplements in relation to heart health? So where do you stand on statins? Are there alternatives to statins like red yeast rice? And what other supplements do you want us to be taking to maintain heart health and overall health.
You go for it, Doc Batiste.
All right. So I am not opposed towards medication. So I don't stand against medications. I think the first situation, or my stance is first, really going back to what Dr. Kahn said originally, is that I want to know the full profile. I want to understand what your C-reactive protein is. I want to understand what your Lp(a) is. I need to understand, are you an individual where I'm treating you after a heart attack, that you've had an actual heart attack that's been documented, or am I treating you before you actually get to the point of a heart attack? That's important. That's primary prevention versus secondary prevention. And the studies are slightly different in terms of the power, the influence, what we call the number needed to treat, according to who I'm treating in that particular moment. I next want to know what your values, what your levels are of numbers that are there, combined with the inflammation that's there. And if you're primary prevention, I'm probably wanting to know if those numbers are intermediate or normal. I need to know what your calcium score is, for sure, beyond a shadow of a doubt. I need to have a sense of what your calcium score is. Once I get to all of that, I'm likely using something where I'm using a pharmaceutical agent like a statin or some derivative of a statin that's prescribed. Now, I have had patients who have found success with red rice yeast, but however, the dosing, I haven't yet personally, I haven't found one that is sustained and replicable that I'm able to confidently prescribe. In terms of CoQ10, which is another supplement that perhaps I use to kind of offset some of the side effects, are things that I've used. There are some other agents that I've used. We've gone away from niacin. There are some others, berberine, and some others that I haven't used as much, but I've toyed around with in certain patients based upon where they're at. But my starting point after nutrition, that's the obvious, is I then will go towards a statin. Now, I've had patients who I've achieved the goal, and then I've followed up. What's their Lp(a)? What's their C-reactive protein? But making sure they don't have familial hypercholesterolemia. All these things are extremely important, and they really dictate the tool that I use, but I leave open to myself all tools in the tool chest.
Yeah, and again, we're going to agree on a lot. There was a society in 2007 that formed called SHAPE, the Society of Heart Attack Prevention and Eradication. And it was a very academic group. I think they still have an active website. You did not hear as much about them. But they proposed that we're treating some people with lifelong prescription statin medication who don't have atherosclerosis and may never develop atherosclerosis. And they proposed, it was just a theory, that if you got a carotid ultrasound and a calcium score, you might choose not to use prescription drugs in people that have no atherosclerosis and teach them about diet and exercise, maybe supplements, and follow them, just like a clean colonoscopy might be followed up with another one in 5 to 10 years. And the downside to that is, there may be some disease developing during the period you're not treating them, and they may come back in 5 years, and now their calcium score went from 0 to 68, and maybe earlier treatment might have prevented it. We have no perfect way of knowing that. I saw that in 2007. It struck me, and that's sort of the practice plan. But I literally struggle with patients. I struggle with myself with patients on this question. I had a 39-year-old, my last patient today, referred to me from Northern Michigan. It was a Zoom call. And his cholesterol is 265. And he was referred by a good nutritionist, which isn't very common. And it turned out he was highly educated. And I had to go through everything. I mean, he was doing the bulletproof coffee thing for a while. But to his credit, he stopped that about a year ago. So his current cholesterol numbers were not butter in his coffee and MCT oil in his coffee. But his nutritionist put him on a high protein diet, which basically translated to a whole lot of grass-fed beef. I mean, he had, pea soup last night. I was excited until he told me I had to have ground sausage in it. And he has a very high saturated fat diet. And we agreed, let's take 4 to 6 weeks. I actually sent him a diet plan to eat whole food plant-based, and he was open to it. And let's find out if you're one of these wonderful people that your cholesterol drops 80 points in 6 weeks on a plant-based diet, high in fiber, low in saturated fat. Not everybody's open to it. He was open to it. He goes, I want to be healthy while we get a calcium score. But a calcium score at age 39 is a mixed bag. It's very inexpensive and it's available, but at that age, there may be more soft plaque, which is invisible, than hard plaque. And there's a more advanced CT scan I love, but it's expensive and it's not for everybody. So you will struggle with it, and we'll circle back. I am schooled in supplements. I also agree, there were 5 people that died recently in China from red yeast rice that was contaminated. People go to Consumer Reports and read about red yeast rice. On the other hand, you go to PubMed, the National Library of Medicine, there's a lot of data that's in the peer-reviewed literature. There's studies that are up to 5,000 people randomized to red yeast rice or placebo that show that it lowers cholesterol and has a clinical outcome. So I think for many people, it's an option. I use statins. I live in a town, Detroit, where one of the more prominent integrative doctors wrote a book called Statin Disaster. Many of my patients have read that, and I've got to kind of redirect them at, this is not a disaster. These are very highly studied books, drugs rather, after reading that book. But my own little spin on it is, if I can, I keep the statin dose low, which is not necessarily conventional. Doctors like medium and high dose. In fact, it's called HIS, high intensity statin is the abbreviation you'll see in journals. And I add in a second drug called ezetimibe. And it lets me hit these super low LDL levels that cardiologists are gaga about, and I believe in, for people with advanced disease. But I don't have to use 80 milligrams of a statin, because statins do have myalgia problems. Statins do raise blood sugar. Statins do raise lipoprotein A. And there's a wonderful research study from Korea called the Racing Study, where this low-dose statin plus ezetimibe, Zetia, was proven to be actually better at reversing plaque than a medium-dose statin alone. So I kind of reach for that as my preferred choice.
Thank you. If you would like to ask a question, please raise your hand in the Reactions tab. Just go to Reactions and click the raise hands so I can call on you. When we get a blood test and we get the results of our cholesterol, and we get an overall cholesterol, we get an HDL, we get an LDL, how do you want us to interpret it? I've somehow thought that if it's below 150, you're very protected from heart disease, but some people I know who are plant-based are over 200. What are we hoping for? What should we be concerned about? How do you want us, when we get the blood test that gives these numbers, to think about it? And is there anything else on a common blood test that you want us to pay attention to?
Yeah, I'll jump in and give a quick answer. A lot of this goes back to probably about the 1970s, a famous study, the Framingham study. And there's many others. There's no doubt when you take a large population, the higher your total in LDL cholesterol, the greater your long-term risk of atherosclerosis. That's a proven concept. But Dr. Batiste and I don't work with large populations. He does it as an administrator. But when we're treating one patient at a time. And we all know there's people that smoke and don't get cancer. People with high cholesterol don't have cardiac events. And you try and be as personalized as possible with people. We also know, to answer your question, that cholesterol and LDL cholesterol is a risk factor for coronary disease, along with blood sugar, along with blood pressure, along with smoking, along with family history, and along with actually 10 plus other items like lipoprotein A and inflammation markers, and now TMAO markers, if you want to do that at all. So I try and get, and what the Framingham study showed was actually one single risk factor may double your risk of heart disease. But if you stack them together, if you happen to be a diabetic who smokes with a high cholesterol and high blood pressure, boom. And I try and do that in my head or do it with risk calculators. That cholesterol combined with obesity, sleep apnea, and any other things, try and put it all together and impress upon the person. But as I said, if there's no emergency, I'll pull out forks over knives and other training guides to try and get people, give them a month or two and see what they can do with lifestyle. And they may fall and crash and burn, and then we move on. But I mean, there are those wonderful examples. They're not uniform. And there are all those frustrated vegans you mentioned. They're eating a lot of fiber and their cholesterol's high because genetics are a very real factor in, cholesterol production, without a doubt.
Thank you.
I absolutely agree. I mean, I think in general, when you're looking at your cholesterol values, just being very transparent with the question. I mean, obviously, when your levels are over 200, it should mark as a level of concern for your total cholesterol, but not sure exactly what that means in total. We need to know what the breakdown is. And so you want to get a sense, are you a typical kind of metabolic syndrome where your HDL or good cholesterol theoretically is low, your bad cholesterol is high, your triglycerides are high, which may be a reflection of the types of foods that you're eating, whether they're vegan or not, but they're refined and processed and you're eating vegan standard American diet. And so really making that effort to transition, but really getting a sense of and then in the context of the history, like what Dr. Kahn said, becomes so important. Have you suffered a series of silent heart attacks or cellular heart attacks or other issues that are there that really shift in terms of our level of aggression that we may need to undertake? But I think the first recommendation out of every non-lifestyle guideline still pertains to lifestyle, right? Even though we skip over it. And so to Dr. Khan's point, we give you an opportunity. Here's the balance. Here's the difference. Here's a challenge as a clinician that we may have. I don't know if you stop taking the medication. I've had patients who've had phenomenal transformations. And they don't come back and see me, and it's been a year or two, and they somehow, oh, I slipped, doc. And now their numbers are through the roof high, and they're saying that they're having symptoms. Whereas I may have means of knowing whether or not you're adherent to medications based upon your refills. So there's multiple factors that have to come in place, and we really have to tailor it down to an individual on a personal level at all times.
Thank you. Joe, would you like to ask a question, or where are you from?
Yes, I would. Huntington, Long Island, New York. Great panel, gentlemen. Thank you for your beautiful knowledge. I have two questions, but I first have to say I miss Dr. Kahn live and in person because he has a lot of humor that he puts into his presentation that you really can't get on Zoom. But anyway.
Thank you.
Yes, I missed that. My first question is a year ago, I got a diagnosis of 15-centimeter mass in my left kidney. I've been probably for close to 30 years a really good plant-based whole foods eater. In fact, I go a little bit further. I even grow my own food. In the last several years, I've been really, really concentrating on eating more of my own food than store-bought. So I'm doing outstanding. I actually have no impediments or pain or anything. So I'm doing a variety of treatments that seem to be working. But one of the things I've added was every other day, 2 eggs from my neighbor friend who raises organic chickens, and I trust him. And I was just wondering what you thought about what are potential problems that you've seen with someone who perhaps every other day eating clean chicken eggs in their diet. And the second question is, in the last year or so, have you seen an increase in myocarditis in patients?
Well, I'll do eggs, and I'll let Dr. Batiste talk about maybe myocarditis, since he's more in the hospital world where you're going to see it. I mean, my first reaction is, how does the chicken feel about these 2 eggs a week? Because, part of the motivation to be whole food plant-based, can extend from health to the environment to animal cruelty, animal rights. Now, this sounds like it's probably a nice, rural farm, and you don't kill a chicken to get its eggs. So it's not as dramatic a conversation as, eating chicken and eating beef and eating turkey and slaughterhouses all over the place. But anyways, I would like to get the consent of the chicken first. Number 2, there in the last couple of weeks, there was a headline study randomizing people, I think it was 10 eggs a week or less than 2 a week, on blood cholesterol levels. It was funded by the egg industry, and it didn't show a dramatic change in blood levels with the high number of eggs. Actually, many researchers over many years have said that there's a relatively, we always say that egg yolk is packed with cholesterol, but it's actually not that much compared to the large amount of saturated fat that most Americans are eating, with the protein. I'll have everything with protein. All my patients, I have my nice salad and I make sure I have protein in. Of course, they're talking about a chicken breast or a salmon fillet or, beef strips. Saturated fat has always been the target of nutritional counseling and guidelines for reducing the lower cholesterol. And it hasn't actually been dietary cholesterol. It's been the focus. Still, the last guidelines say reduce your dietary cholesterol to as low as possible, but they didn't assign a number. They used to assign a number in milligrams. So I don't think your health will suffer from 2 eggs a week. I don't know that your health will benefit. There is a chemical called choline in eggs. You can get it in soybeans, but some people speak about eggs for that reason. Trying to think of anything else that's relatively unique. The flip side is that there is a chemical called TMAO. I mentioned it briefly. Probably 2 eggs a week are not going to raise your TMAO too much. But in the last 3 weeks from the Cleveland Clinic, there was a very large paper that you should read about elevated blood TMAO levels, which is a Quest lab. You can have your TMAO level done tomorrow. And elevated TMAO levels in progressive kidney scarring and kidney disease. And it was 10,000 plus patients. So if you're dealing with, management of a kidney problem, even if it's a tumor, and you might have surgery or maybe you already did have part of your kidney removed, I would want to be sure my blood TMAO level wasn't elevated. Whether 2 eggs will do it or not, can be answered by a simple blood test. So maybe follow up with that.
That's great. I don't have much to add with that. Since I don't have much about the myocarditis, I do want to just chime in with one thing. I think I wish I came up with this characterization, but I didn't. But food oftentimes is characterized. Food is culture, but food is also characterized as a red light, green light, and yellow light, like we're driving. And if you think of it in that context and you apply it to research, what I tend to ascribe to research that's really irrefutable for the most part are going to be green light foods. Research that is overwhelmingly negative is red light foods. And for yellow, where there's this back and forth, we're seeing a multitude of studies telling us, it's probably not beneficial. A few saying, I don't know if it's harmful. And there's questions that arise. I think at that point, you have to ask yourself, what am I ingesting this for? For my health? Is this adding to my health? Or is it adding just for my culture? Or is it and if you're looking to kind of be the healthiest version of yourself possible, I believe you have to pause and ask the question of, is there potential harm that can arise, the relationship with diabetes or cardiovascular disease or prostate cancer in some patients that have been shown in some studies? What's the size of these studies and variables that are there? When it comes to myocarditis, I'll be honest. As opposed to training, I see a lot of things I never saw increasing over the past 5 years before the pandemic, right? I've seen increase in Takotsubo. I've seen increase in myocarditis, more comparison to where I've seen before. Now, that relative increase, it's still small numbers. They're few and far between. But when you ask the question of, have I seen more? I would say anecdotally, I have seen more in my practice than what I saw in the first half of my practice compared to the second half of my practice of 18 years. I've seen more increasing that's here. The cause, I can't be certain of the cause, but we've seen it there as far as increasing. Yes.
Julie, would you like to ask a question? And where are you from?
Hello.
Yes.
I'm from Atlanta, Georgia, and I was diagnosed with polycystic kidney disease in 1996, had a kidney transplant in 2010. I do triathlon, and recently I was diagnosed with atrial fibrillation. And I wanted to know what your take is on the ablation procedure. And I have been plant-based since 2017. and still doing triathlons, age
Wow.
69.
You take it, Doc Batiste.
So I missed a portion of it. So the question was about ablation, is that correct?
Right.
And about whether or not to consider ablation?
You
Julie,
got it.
and so the diagnosis, Julie, for your ablation is, what is the diagnosis? Is it atrial fibrillation or is it a supraventricular tachycardia?
She said atrial fibrillation.
So atrial fibrillation, I do believe right now our technology has improved in general for ablations. What I advise patients depends upon the type of arrhythmia that a person is having. And what I describe as an arrhythmia is like when you turn the light switch on and you have fluorescent lights. You can have different types of issues that can happen from the circuitry that goes through. You can have an issue where there's no communication at all. You can have an issue where it blinks a little bit. You can have the fluorescent light blinks. And so different arrhythmias may be more beneficially treated by ablation. Atrial fibrillation has historically was less inclined to that, but that's improved with technology right now. And the current guidelines is that really nearly everyone may be offered an ablation. I should say be considered for an ablation if there are certain factors that meet criteria and are not prohibitive. So a lot we would have to know what your echo looks like, what your top part of your heart called the left atrium looks like. They would have to do pulmonary vein mapping. But if all of that has been done and the electrophysiologist or electrician of the heart feels that they can be successful with it, I think it is a worthwhile if it's causing significant symptoms with you. In terms of whether or not that alone will eliminate your need for blood thinners, if you require blood thinners, that is not the case typically as it relates to the purpose of the ablation, but it is to help alleviate symptoms that may be able to help decrease other medications being used to help control the heart rate response and symptoms. The other thing I'll add to it is that there have been studies, and Dr. Kahn could probably speak to this as well, that you mentioned the triathlon, your activities there. I'm not sure the length, but we know that for endurance athletes, that there is perhaps a higher preponderance of atrial fibrillation in the irregular heartbeats when they engage in this long distance type of activity and running. And so I've had the unfortunate pleasure or displeasure of advising some of my patients to perhaps consider backing off because of the occurrence, and not all, but a few where I have seen that, and that's been corroborated inside the literature as well.
And I'd say very, good comments I agree with. Again, an interesting paper out this morning. I did a little Instagram post on it that I think it was out of Europe, that in the course of a person's entire lifetime, the risk of atrial fibrillation used to be 24%. It's risen to 31%, maybe because people are heavier, more sleep apnea, more high blood pressure, and maybe more coronary artery disease. But the two biggest risks of developing atrial fibrillation were about a 20% lifelong risk of stroke and a 40% lifelong risk of congestive heart failure. So if you're really suffering from atrial fibrillation and the doctors say that they may be able to eliminate it with an ablation, the hope would be you'd be lowering, if not eliminating, your lifelong risk of stroke and congestive heart failure, which are no small things.
Aruna, do you have a question, or where are you from?
This is Aruna from Maryland. I have a question about blood pressure. So if you have high blood pressure, should you avoid salt completely, or is there a safe limit?
You want to start off?
You take it.
Yeah. So, I mean, there's study after study after study kind of tells us that it's described as low sodium intake, but we have to understand that there's sodium in all of our foods, just in general, right? So when we look and we understand that 1 teaspoon of salt contains really practically 2,000 milligrams of sodium. So you look at a low sodium content of food with the DASH diets, where most of the studies have done and shown an astronomical decline in blood pressure. There's some studies that have shown as much between 10 and 15 millimeters of mercury declination with adherence to a low salt and adherence to increased fruits and vegetables in their dietary practice. I tend to, but I do understand the taste and the flavor as it relates to things. And that's what life is all about, that flavor that's there. I do have some tried and true low sodium or no salt seasonings that I recommend, whether it's Benson seasonings. I increase the spices, increase the celery, which gives that salty like flavor that's there. Some tricks that I try and utilize, I increase for my own self the spices because it helps me divert my attention from the absence of salt that's there. But that's where we also know there's other research that's come out in Journal of American College of Cardiology about 3 years ago, put out a wonderful article really outlining the impact of sodium or salt really on the entire vasculature and on the gut microbiome and the complexity. It's not just about water retention, but there's a confluence of issues that begin to happen. So I tend to advise my patients to be very intentional, first of eliminating what accounts for 85% of the sodium in the diet, which is processed, boxed, and canned foods. If they can do that, that's the biggest hurdle. I mean, I'm trying to shoot for patients to get off over. If they can get that, I mean, they usually are improved. If I need additional help at that point, now we're tweaking and we're deciding, are they adding a small amount to their food as they cook it, or are they adding it afterwards so it's on top of it in a measured amount and they have the little small flavoring and not cooking with the food that's there. So those are some tricks that I use. Dr. Kahn probably has his as well.
I'm totally agree. I'm all for salt substitutes. They can be potassium-based salt substitutes if your kidney function's good, or they can be all herbal salt substitutes. I actually like a blend that has a little kelp in it. There's a number of salt substitutes that have kelp because iodine's a little tricky to get in the diet, and it's been shown to be a little tricky in the plant-based diet. And iodine does have a role for thyroid health and some other systems, including sometimes cholesterol levels. So don't ignore a little kelp flake. Some of them are really tasty.
Tammy, would you like to ask a question, and where are you from?
Yes, can you hear me?
Yes.
Yes, I live near Chattanooga, Tennessee. I actually was involved with a consult with Dr. Kahn once for my mother, and I think he's an incredible person. I have a question for him about eggs. This egg thing that's going back and forth for years drives me crazy. I'm sitting here with a paper from the Canada Journal of Cardiology. It's from 2010. Primary author is a J. David Spence. I don't know if you know him. It seems like he spent a lifetime doing research with stroke patients. He's a neurologist. He seems to think that egg yolks are very bad for you for several reasons. Let's see if I can briefly tell you from the abstract. Increases the susceptibility of low-density lipoprotein to oxidation, increases postprandial lipemia, and potentiates the adverse effects of dietary saturated fat. The paper is very compelling. He also, they talk about research studies from people, and the effects were that 1 egg a day basically doubled your risk of cardiovascular disease if you were diabetic. And then they talk about studies on like apes or monkeys that the egg yolks were shown to cause arteriosclerosis. I'm just asking you what you really think about egg yolks. I mean, my impression, I'm struggling with my own genetic risks, which are pretty overwhelming. And it seems to me like after reading this paper that eating a lot of cholesterol at one time is a really bad idea if you're at high risk of cardiovascular disease.
Yeah, we did have a question before that both Dr. Batiste and I answered. And, number one, egg yolks are not an essential food. I mean, I'm 45 plus years into plant-based without any egg yolk, and my biomarkers and my vascular studies, and thank God my overall health are pretty darn good. If I'm missing something essential, it hasn't shown up so far. There is a small argument about choline being a brain-friendly compound, but as I mentioned, legumes, and particularly soybeans, one of my favorite snacks is dried soybeans. And maybe I'm just, getting enough choline through plant-based sources. And I encourage you to try that. A lot of what you said, there is that research study that particularly in diabetics, eggs and egg yolks particularly do increase the risk. I think Neil Barnard, I think it was in the documentary What the Health, but maybe one of the more recent documentaries, took a lot of heat for that, but he was quoting the literature as he always does so well. So I do encourage my patients. Now, I make a statement to my cardiac patients that when Dr. Dean Ornish designed the lifestyle heart trial, he did permit on his food pyramid egg whites because in the late 80s and early 90s, we didn't have a lot of plant-based options and Whole Foods and Trader Joe choices. And I imagine he was concerned what his patients were going to eat. And now there's so many choices, it's not necessary. But even with that option, he showed the dramatic difference in coronary progression versus a group that did not change their diet. So again, you have to read your patients. I like the statement, inch by inch, it's a cinch, pound by pound, it's hard. People that are desperate and in bad shape will change overnight. They'll read the Ornish book, the Esselstyn book, they'll watch Forks Over Knives, and they will grab it. But for others, you might have to coax them a little bit. And if they want to have an egg white omelet with spinach and red peppers and saute it with just a touch of something in the pan, it's okay by me, and we'll work on it on the next visit.
Amy, would you like to ask a question, and where are you from?
Hello, yes, I'm from San Diego.
Okay, go ahead.
I have a question on miso. I love miso, and I had a book, it was a real old book about miso. And the authors, traveled to Japan, they made miso, and, it's a really awesome book. And they said that for some reason, miso does not raise salt levels in the body. And I found that interesting because I was in the hospital a while back, and they did my blood pressure. I thought, oh no, I love miso, watch out. And my salt level was, my blood pressure, everything was absolutely normal. And I was really shocked because I thought, and I don't know if you have any evidence or know anything about that. And I'm not promoting anybody. Please do not just eat miso and say, it doesn't cause any sodium problems. Please don't take that as that way. My inquiry is if either of you gentlemen, and you guys are doing an excellent job, have any information about miso.
I actually have a jar of miso in my refrigerator most of the time. And I will agree, it's an organic, good brand, but it is a very salty product. And I can actually only for the flavor, because I'm so unused to salty foods, it's a little dab will do you in my life. I actually enjoy it, but it's a fermented food, and it's high in protein and all the components that make soy a good choice in anybody's diet, but certainly in a plant-based diet. But I'm unaware of a research study I can quote you. Traditionally, blood pressure in Japan is lower than the Western cultures, so they don't seem to be suffering from miso, but I'm not sure the quantity, how much miso goes in a cup of miso soup. I think very little, actually.
It's a great answer. I don't have anything to add.
Yeah.
Alexin, do you have a question? Where are you from?
Hello, I'm from Monterey, California, and I am on a vegan diet, drinking a gallon, maybe a gallon, a little more a day of water. And I know you addressed salt a little while ago, a few minutes ago, but I didn't catch how much salt should I be adding salt to my diet, or iodine, because I drink so much water?
Yeah. Why don't you?
Yeah, so I mean, I think roughly we kind of estimate the human needs roughly around 1,500 milligrams of sodium that, and you're able to get quite a bit from the foods that you eat. So there may not be a need for you to kind of really focus on added. I would presume that with your raw, you're probably having more than just salads and probably doing things that are dehydrated and being adherent to the temperature in terms of your preparation. So I would probably imagine that there's probably a limited need. And I would maybe even suggest that you might track, there's lots of trackers out there as you put in your food that will actually give you a breakdown of your salt, excuse me, of your sodium, potassium, the minerals, the fats and carbohydrates and fiber as you enter into it, like MyFitnessPal and some others that might provide you like a real hard perspective on how much you're intaking on a daily basis based on what you're eating.
Okay. I'd like to ask you a bunch of questions that you could just give us a thumbs up or thumbs down. So we don't have time for detailed answers, but just to send us in the right direction in terms of, is this something that you are saying no problem, yes, or you're saying avoid? So I'm going to just make a list. You could use the words yes or no. You could use your thumb, whatever you like. Okay. So, and I guess this relates to overall health, but especially to heart health. Number one, alcohol. Okay.
I feel like we're about to play rock, paper, scissors.
So that's a no. Is that all alcohol, including a glass of wine?
It's a public forum. We have to give the public answer.
Okay. Next question, coffee. Okay.
He's giving neutral.
but it's all the other stuff.
Yeah.
How about fasting? Let's call it water fasting. Okay. How about coconut products, meaning coconut yogurt, coconut ice cream, coconut oil?
No.
Okay. How about saturated fats in nuts that have a lot of saturated fats like macadamia, cashews, and Brazil? So raw macadamia nuts, raw cashews, raw Brazil nuts.
Raw.
Okay. How about DHA, EPA supplements that some people have said we need for dementia prevention? So like algae oil, algae oil that is should be used as a DHA, EPA supplement.
I'll give it up.
Okay. How about supplementing with magnesium? A mineral magnesium.
I'll give it up.
Okay. I don't know if we covered the subject of stents, but is this something that at times is appropriate? Okay. And then I guess this is too big a question to really throw in here, but I'll throw it in anyway. Even if you're pro lifestyle, is bypass surgery something that at times is necessary? Okay. How about far red infrared saunas? Because someone's going to be in their heart, they might be concerned going up to 135 degrees. You're okay with that. Okay. What about cold water plunging, where you go into freezing water, and while it might have health benefits, it does seem a little shocking to your body. You have any thought on cold water plunges?
I hate it.
No research on it on my part.
Yeah, there's no research, but yeah.
It's
more a fad right now than anything.
Aside from it might not being beneficial, are you concerned that it could be dangerous and cause a heart attack?
Yeah. In some people, there's actually lots of data for sauna. There's, safety data too. There's just absent data for, polar bear jumping into the lake or your garbage can full of ice.
Is cold, if someone goes skiing, do you get heart attacks if it's too cold? Is that a thing, or is that something to be concerned about, being out in too cold of weather?
Yeah, it's a strain. It's a stress. We did this silly study in my hospital where we actually had people wearing Holter monitors, shoveling snow in the hospital parking lot, and we published it. And you can reproduce a stress test by cold weather with some physical activity.
Okay. Supplementing with iodine. Some people say that it's no longer in the food and it's an important thing and hard to get.
Yeah.
Okay. How about olive oil, extra virgin olive oil in a dark glass bottle? Are we trying to avoid this? Neutral, not have it?
Literature says it's okay.
Okay. So if that's olive oil, and then what if someone said, what about high quality hemp and flax oil? Is that also the same as olive?
I don't have research for that.
Yeah. I'd give it there's other ways to get it. Always Do the seed.
Okay. How about CBD is a popular thing. Is CBD products? Any thought on that?
I'm neutral.
Yeah.
Okay. How about people who at night say, I need to take a very small amount of a sleeping pill to help me go to sleep? Is this a heart issue at all?
Yeah. I'm assuming you mean some sort of
Yeah,
anxiolytic.
prescription. Yeah.
So
Yeah.
not good.
Okay. What about we've been told that nitric oxide is good and that you get it in green vegetables. Are you concerned about oxalates from too many green vegetables? Is that a concern, or should we have as many green vegetables as we can?
I don't know what to do with my thumb. Not concerned.
Yeah, I'm not concerned either.
Okay. Someone says, I heard your lecture. I'm not going to have any more beef, so I've been eating Beyond Meat and Impossible Burgers every night. Is that better, worse, neutral? Is it still not so great?
Yeah, it's not great. It's better than the red meat, but it's not great.
Okay. Sea vegetables, kelp, nori, wakame. Do we want to try to add these in our salads? Does it not matter? They seem to have salt in them, but good. Okay. The whole thing from years ago when they talked about lectins, does this concern you in a plant-based diet? No concern.
Not concerned.
Yeah,
okay. And then I guess someone says, all right, I understand everything you're saying. I've read your books. It totally makes sense. I logically could take a test and get the questions right, but I live in the real world and people like to sometimes socialize at restaurants, and sometimes people order dessert, and sometimes people order a drink. So the question really is not what is true, but how extreme do we need to be? Meaning, yeah, how extreme do we need to be? People want to have some dessert. They want to have some alcohol. They want to have some of everything. And some of us are super disciplined and can be militant about it. But a lot of people are saying, I got to have a balanced life, and it's too hard to be 100%. So how strict do you need to be to get the results that you need to protect yourself on everything?
I think very. I'm not going to say 100, but I think very. I mean, I think Dr. Esselstyn gets credit for the quote, moderation in diet is like moderation in, atherosclerosis, moderation in bypass. So you do want to be very attentive to your diet now.
And I would say it's like locking your doors and saying the alarm and leaving your windows down.
Yeah.
Okay.
Good analogy.
Okay. If each of you could give us any final closing thoughts that you want to leave us with on cardiovascular health. Dr. Kahn, you want to go first?
Yeah, I'm not sure it's completely preventable. I'm not sure it's a paper tiger, but I sure know we're underselling the idea that starting in youth, really, that's when we need to be teaching in, elementary, middle, and high school and college, that, this is a lifestyle-driven disease to a very large extent, and it's a lifestyle controllable disease. The younger you start, the better you'll be. And we hopefully will have a Real Truth About Health conference in some future era where we don't have to talk about heart disease because we've grabbed onto lifestyle. So, do the lifestyle, do the testing, and be a student for life, because things do change over time.
Thank you.
Love it. I would just add a couple of words. One is be intentional. Be intentional on what you're saying out in your plans for the day in terms of what you're going to eat, how you're going to move your body, feed your body, and rest your body. I think be intentional in terms of your expectations of your docs, in terms of the knowledgeable about the studies that you need to know, and asking, what does this mean and why, as opposed to just accepting. And I think decrease the stress, the worry. Decrease these play a substantial role in the manifestation of disease. Study after study is telling this over and over. And so we have to focus on building, what are you doing for your health, and as opposed to what am I not doing? I don't do this, I don't do that. What do you do for your health? What are you eating for your health? Focus on that. And you make that the goal of every single day, your gratitude, your forgiveness, all those components. That's some of the keys towards living an enjoyable life. In other words, they call that the dash between your birth date and your death date. that dash. You want that as enjoyable as possible.
Thank you.
Amen.
Dr. Kahn, how do we follow up with you, stay in touch with you, contact you? How do we get in touch with you? How do we get more information from you if we want to stay in touch with you?
Central website, drjoelkahn.com, drjoelkahn.com. Link to the clinic, link to my podcast, books, and blogs and videos.
Okay. And
Thank you.
if someone wants to do a consultation with you, you will do a Zoom or a phone consultation?
Yeah, in about 20 states I'm licensed in, California to New York, but it's not 50 states. So I do follow the rules.
And do they get to speak with you?
Yeah, only me. 60 minutes on the clock. Yeah.
Okay,
The
great.
joy. I love it.
Thank you. And Dr. Batiste, how do we stay in touch with you and follow up with your work?
Yeah, drbatiste.com is the easiest way. We're creating a community just to kind of bring out the pillars of selfish, really, as we kind of move forward. And social media there too as well. Columbus Batiste can find me.
Thank you very much. I appreciate both of you. Can we unmute so that everyone else can say thank you as well?
Thank you all.
Thank you.
Big X.
Best.